everyone, and welcome to the Healthy Living Show. I'm Sondra Smith. I'm the Chief Strategy Officer for Hilton Head Regional Health Care, and today I'm substituting for Debbie Lyons. Debbie's out, and I'm happy to be here with Dr. Claude Tolbert. Thank you for joining us today.
Welcome. Thank you. Glad to be here.
Today we're going to be talking about the Pelvic Health Institute and some of the conditions that are treated there. We're going to talk a little bit about minimally invasive surgery. So thank you for joining us. Before we do that, Dr. Tolbert, I know that you've been on the Healthy Living Show before. I feel like our audience knows you, but just in case, would you tell us a little bit about your training and your background?
Right, so I've been in Beaufort County now for over 20 years. My training started at Eastern Virginia Medical School in Norfolk, Virginia, and it was there that my interest in minimally invasive surgery was birthed. The Jones Institute is known for aggressive laparoscopic surgery and had extensive training, and it gave me just enough of a desire to build upon it. So once I left residency at Eastern Virginia Medical School, I started my practice here in Beaufort, and opportunities presented themselves where I could continue to advance my skills in minimally invasive surgery, and the robot started being very popular, and I've been doing that now for probably about 12 years.
Okay, and so the minimally invasive surgery is an important component or tool that is involved with the Pelvic Health Institute. Could you tell us just a little bit about what the Pelvic Health Institute is? What does that actually mean?
So the Pelvic Health Institute, it is a collaboration of health practitioners that are focused on addressing issues that involve the pelvic problems that women often experience. And it's kind of a multimodal group of people. We have surgeons, but we also refer patients out to pelvic floor therapists for hands-on, depending on what the symptoms and the presenting problem is.
Okay, so it's a team effort of various specialists. Now, the Pelvic Health Institute has those key words of pelvic, and you mentioned the pelvic floor. What exactly is the pelvic floor?
The pelvic floor is actually the base of your core. So with this being our core, the pelvic floor is the base of that. And if you can imagine, the pelvic floor is actually shaped like a bowl, and the muscles that provide that support, if you will, is more so shaped like a hammock. So it attaches anteriorly to the pubic symphysis and then posteriorly to the tailbone, and that provides the primary support of the pelvic floor.
And what is it supporting?
Well, the pelvic floor is very important because it supports those vital organs such as the bladder. In females, it supports the uterus and cervix, and then the rectum itself is supported. The pelvic floor is also important because there are important nerves and blood vessels that course through there that provides and allows for different sensations in the pelvis.
Okay, and so those organs that you're naming, I know that obviously men don't have a uterus, but they do have the bladder and the rectum. Do men have a pelvic floor as well? Men
absolutely have pelvic floors. And the pelvic floor, it provides some level of support for men as well, but oftentimes symptoms that men may have as a result of a dysfunctional pelvic floor may be slightly different than what you see with women, but just because of the anatomy, but men can have issues with the pelvic floor as well.
So what are some of the issues that women see with the pelvic floor? What kind of disorders?
So when there's a problem with the pelvic floor, you can have scenarios where either the muscles are too tight, or you can have scenarios where the muscles just aren't strong enough. So let's, for example, start out with muscles that are too tight. So oftentimes, these patients will present with complaints of pelvic pain. For the longest, doctors have thought that pelvic pain primarily was caused by the uterus or the ovaries or endometriosis, and we look for things of that nature, but a lot of studies have shown that some pelvic pain originates from the pelvic floor, from those tense muscles. Those nerves that I referred to earlier, those nerves, if they're in an unfriendly environment where the muscles are tense, they tend to be hyperactive or hyper-responsive, and it can cause things such as vulvar discomfort, pelvic floor pain, urinary urgency. Problems with sex is a very common one.
Okay.
So that type of problem tends to respond better to more hands-on physical pelvic floor therapy.
Okay.
And then on the opposite extreme, you have where the muscles are just not strong enough. They've kind of lost their capacity to keep good support, so to speak. And in scenarios like that, you have more of a herniation of those vital organs we discussed just a few minutes ago. The bladder may drop down into the vagina. The rectum may bulge up into the vagina. Or the uterus and cervix may just actually drop down into the vagina. And sometimes in very severe cases, it actually comes all the way out.
Oh my goodness. So obviously you would know if that was happening. What are some other symptoms that maybe are kind of in the middle that women might experience with that?
So most times women will begin to notice that they're feeling more of a pressure in the pelvis, a bulge, or they may say that I've noticed that as the day goes on, I'm on my feet, I feel more like there's a golf ball or something between my legs.
Okay.
And so that's typically the symptoms that women begin feeling. It's just a very subtle sensation that over time can progress. And in severe cases, women may begin to have some urinary dysfunction to the point where, you know, when I urinate, I don't think I'm emptying my bladder all the way. Or when I have a bowel movement, I can still feel stool there, and it feels like it's right there in the vagina.
Okay.
And so those are symptoms that you tend to see when the prolapse is pretty bad.
Okay. And so is that then what may lead to incontinence, that, you know, when you urinate and you don't want to, if you're stressed?
So incontinence is a example of pelvic floor dysfunction. But you also can have urine retention from pelvic floor.
Oh,
it just
either
depends.
way.
It just depends on the degree of herniation you have. As I explained to some of my patients, if the bladder and uterus are being pulled into the vagina, the urethra is connected to the bladder. And so if it's being pulled more anteriorly, it will kink the urethra. So that actually helps with them keeping urine in, but they can't get it all out in a bad way. So oftentimes when we do these repairs, the patient is evaluated extensively by our urogynecologist to make sure, well, if I do this repair, are you now going to leak?
I see.
And then you have scenarios where just the bladder itself has dropped out of that pressure zone of the abdomen, and it doesn't have that pressure zone to actually physically or physiologically, I should say, close off that urethra when a woman urinates or wants to urinate. And that's when you have the incontinence issue, or when they cough, they sneeze. And then here again, our urogynecologist will address that by trying to bring the bladder back up into that high pressure zone inside the abdomen, to raise it up a little higher to provide that shut-off valve, so to speak, to prevent leaking.
I see. And so a lot of these things that you do to take care of these conditions sound like surgery. So is that where the minimally invasive surgery part comes in?
That's exactly an opportunity for the minimally invasive component to address these patients. But I will start by saying that our initial approach is always conservative therapy. We try to assess, number one, what are the patient's desires? What do you expect after this? What quality of life are you looking for? Some patients may opt for a pessary. A pessary is a prosthetic device that they can be fitted for in the office, and if the prosthesis or the pessary is placed properly, the patient will not feel it. She'll be able to go day to day, carry on her activities without noticing that it's there. It just has to come out about every 3 months or so to be cleaned and replaced. But then you have patients, and we're actually seeing this in younger women, where you have very active women who are carrying on busy lives, and they're wanting the problem addressed surgically, and it's a very good option. And so that is where the minimally invasive part comes in. We do our best to number one, achieve what the patient needs with few complications, and to get them back on their feet as quick as possible. And minimally invasive surgery allows that.
Okay, and do you use the Da Vinci robot for the minimally invasive surgery?
Right, we use the WHHI Da Vinci robot for our minimally invasive surgery. Correct.
Okay. Wow. Well, we're excited to hear a little bit more about that. Thank you for joining us to get us started on that conversation. Please stay tuned, because when we come back, we're going to talk a little bit about a new designation that Coastal Carolina Hospital has gotten that's related to that minimally invasive surgery.